Good afternoon, and welcome to Community Water Fluoridation, an essential component for oral health, presented by the Iowa Public Health Association. My name is Janine Moody, and I'm the IPHA Executive Director, and it is my pleasure to welcome each of you to today's session. We would like to acknowledge the support and investment made by the Delta Dental of Iowa Foundation and IPHA's work on the public health practice of community water fluoridation in Iowa. Due to the number of attendees on this webinar, all participant lines will be muted during the presentation. To submit a question for our presenters, please use the questions feature in your GoToWebinar control panel. We will monitor all submitted questions and post them to our presenters during the question and answer portion of the webinar as time permits. Today's webinar will be recorded and posted along with presenter slides. A few technical tips for optimizing your webinar experience. 1, use a USB headset. 2, use a wired connection versus wireless if possible. 3, close any applications on your computer which require large bandwidth. Now let's meet our presenters. Patricia Hildebrand coordinates the Iowa Public Health Association's Community Water Fluoridation Project, which is funded by a grant from the Delta Dental of Iowa Foundation. Previously, she was Health Services Director for Mid-Iowa Community Action in Marshalltown for 28 years and a nutrition consultant with the Iowa WIC program for 5 years. She has a strong commitment to nutrition and oral health. She wrote and was awarded a grant from the Robert Wood Johnson Foundation to start the Story County Dental Clinic. Also with us is Sarah Carmichael Stanley. She serves as the Water Fluoridation Coordinator for the Iowa Department of Public Health. Before she started this position in October of 2017, she worked for different nonprofits throughout the United States, providing hands-on environmental education on the importance of water quality, reducing pollution, and public health. She has her Master of Public Health degree with a Bachelor of Science degree in Environmental Science and Policy. I'll now turn the webinar over to Sarah and Pat.
Hello everyone, I am Sarah and Pat is also with me, and we are going to be talking about an important topic called community water fluoridation. So like Janine said, Pat is with the Iowa Public Health Association. She's the Iowa Oral Health Coalition Coordinator. And I am with IDPH, Iowa Department of Public Health, as the Water Fluoridation Coordinator. We are both part of the Community Water Fluoridation Advisory Group in Iowa, and the third player involved with the advisory group is the Delta Dental of Iowa Foundation. And we are all a part of pushing forward community water fluoridation in Iowa.
This is Pat, and I'm going to go a little over the outline so we know what we'll be talking about today. We're going to discuss the history of community water fluoridation, answer the question, what is fluoride, discuss the involvement and status in Iowa, and explore how we can all help maintain fluoridation and the oral health of all Iowans. Soon after establishing his dental practice in Colorado Springs, Colorado in 1901, Dr. Frederick McKay noted an unusual permanent stain or mottled enamel on the teeth of his patients. The local residents called it Colorado brown stain. And Dr. McKay did much investigation, and after that concluded that an agent in the public water supply was responsible. He also noticed the teeth were less susceptible to cavities. On hearing about a method to analyze the water, Dr. McKay sent samples to be analyzed. He found that these samples contained high levels of fluoride in the amount of 2 to 12 milligrams per liter. At about the same time, Dr. F.L. Robertson, a dentist of Bauxite, Arkansas, noticed the presence of similar mottled enamel among the children that he served after a deep well was dug in 1909. Later, this water was also tested and found 13.7 milligrams per liter of fluoride were in the water. Fluoride is an ion of the element fluorine and is almost universally found in soil and water, but generally in very low concentrations, less than 1 milligram per liter. The identification of the possible cause for the mottled enamel led to the establishment in 1931 of the Dental Hygiene Unit at the National Institute of Health, at that time headed by Dean H. Trendley. He found that caries among children was always lower with more fluoride in the community water supplies. He also found that when you reached concentrations of greater than 1 milligram per liter of fluoride, the association with improvement in the teeth and oral health kind of leveled off. So he also decided that and found that at 1 part milligram per liter, the prevalence of dental fluorosis was low and mostly very mild. This led to the hypothesis that dental caries could be prevented by adjusting the fluoride level in community water supplies from a very small amount to a range of 1 to 1.2 milligrams per liter. This was tested in a field study conducted in 4 pairs of cities starting in 1945. Those cities were Grand Rapids and Muskegon, Michigan, Newburgh and Kingston, New York, Evanston and Oak Park, Illinois, and Brantford and Sarnia, Ontario, Canada. In that study, the water was fluoridated in one of the communities and not in the other. Therefore, this was a cross-section survey and was performed yearly for 13 to 15 years. And at this time, caries were reduced to 50 to 70% among children in the communities with fluoridated water. The prevalence of dental fluorosis in the intervention communities was comparable to that had been observed in cities where the drinking water contained a natural fluoride level of 1 milligram per liter. Through investigations of water consumption and caries experience across different climates and geographic regions in the United States, it was determined in 1962 that the recommended optimal range of fluoride concentration should be 0.7 to 1.2 milligrams per liter, with the lower concentration recommended for warmer climates where more residents drank more water, and the higher concentration for colder climates. After community water fluoridation, cities throughout the United States found that the dental caries declined. For example, dental caries declined in children 12 years of age in the United States 68% when you compared those in 1966 to 1970 with 1988 to 1994. So what is fluoride? It's the 13th most abundant mineral in the Earth's crust. It is found in surface water like rivers, generally at a low concentration of 0.2 milligrams per liter, and in groundwater at higher concentrations of 0.1 to over 5.0. Ocean water is typically 0.8 to 1.4 milligrams per liter. How does fluoride prevent cavities? Fluoride stops and even reverses tooth decay process that is caused by bacteria in the mouth. Fluoride also helps remineralize the tooth surfaces and prevent cavities from forming. When we look at fluoride, we should realize that there is systemic and topical fluoride. It is important to understand that both work. Community water fluoridation is considered systemic fluoride, where application of fluoride varnishes is more of a topical application. We really need both for optimal prevention of cavities. So why should we worry about cavities? In a time when many Americans do not have health insurance, and more specifically dental insurance, prevention of tooth decay is important to prevent poor oral health that results in chronic disease and loss of work. Prevention of decay is very important for children, especially those from families in low economic areas. Studies have found there is a definite impact of poor oral health on school attendance and educational achievement. Fluoride in the public water system is effective, safe, and affordable. The CDC called fluoridation of drinking water one of the 10 great public health achievements of the 20th century. More than 3,000 studies have been completed on fluoridation, and the overwhelming weight of the evidence, plus more than 65 years of experience, supports both the safety and effectiveness. The American Academy of Family Physicians states fluoridation of public water is safe and effective. A recent study done in New Zealand concluded that the average of quality of life years increases with fluoridation of drinking water. It is important to note that there is no federal requirement to fluoridate. States and local communities decide whether to fluoridate or not. The CDC's Division of Oral Health does provide technical help and training for state fluoridation programs. Currently, 15 states have incorporated mandated water fluoridation for systems serving at least 5,000 residents. So who supports community water fluoridation? Many health organizations support water being fluoridated in public water systems. Here is a list of some of them.
So now I'm going to discuss a little bit about community water fluoridation in Iowa. So what CWF is just the precise adjustment up or down of natural fluoride levels in ground and surface water. Iowa's natural fluoride level ranges from 0.1 in groundwater to over 4 milligrams, 0.1 in surface water to over 4 milligrams per liter in groundwater. In Iowa, the first plants to fluoridate their water have started in 1951, and that's Walk-In Water in Dubuque, and they are still fluoridating to this day. So the optimal number that we are interested in is 0.7 milligrams per liter. Like Pat was saying, in the 60s, we were given a range of 0.7 to 1.2, depending on where you lived in the country. If you lived in warmer climates, it was proposed that we needed a lower fluoride concentration because people drank more water when it was warmer. But due to some scientific studies conducted in 2001 and the invention of air conditioning and a more sedentary lifestyle in the 50s, determined that assumption was incorrect. So in 2011, is when we got the recommendation of 0.7 milligrams per liter. And this is to provide the best balance of protection from tooth decay and limiting the risk of a cosmetic condition known as dental fluorosis. And 0.7 is really not a lot. When you break it into miles or minutes or money, you can see from this picture from the American Dental Association that it really is not a lot. It's like 1 inch in 23 miles, 1 minute in 1,000 days, 1 cent in $14,000. So when we talk about 0.7, we're really not adding a lot to our water supply. And this table just shows that fluoride is not only in water, but it's also in food and soil, like Pat mentioned. This list I got it from the USDA food database. It has over 500 items listed that has fluoride as a nutrient. So it's definitely a great information database. So who's in charge of CWF in Iowa? Well, the Department of Natural Resources is the regulatory agency that gives permits to water operators to fluoridate. They are strictly interested in fluoride levels over 2 and 4 milligrams per liter, which is the EPA maximum levels for a system. So it's a national standard. They aren't necessarily concerned with the optimal amount of 0.7 like we are here. They are just concerned if a system is over 2 or 4. If a system is over 2 milligrams per liter, then they must notify their customers on a monthly basis of the level of fluoride and how that could potentially be an issue and cause dental fluorosis. If a system is over 4 milligrams per liter, they must, by law, remove the fluoride through reverse osmosis, and then they are welcome to add additional fluoride back into the system. Here at IDPH, we monitor and educate. So I'm part of the Bureau of Oral and Health Delivery Systems, and working with DNR and water operators, I ask to get their monthly operating reports, because if they are adding fluoride, they have to test it every day to make sure that they are within that optimal range, which, like Pat was saying, is not a requirement, but is what we like to see to prevent that decay. We also educate. So working with our partners at IPHA and Delta Dental, we provide education through outreach and attending conferences. I am also working on creating toolkits for our coordinators and for water operators, and video for the general public. So how we are currently involved, we are currently funded through a HRSA grant, and that goes through the August of 2018. We are in the middle of writing our next 5-year grant from the CDC to continue with water fluoridation in Iowa. But our current grant is funding my position, the water fluoridation coordinator. We also, with the advisory group, created the CWF state fluoridation plan. And that is going to be monitored and updated as needed. I've also done a data census of the data that we have, and the report is coming out at the beginning of May. And that's going to be an annual report. It's going to be located on our website, and we'll, of course, put it on social media. And so definitely take a look for that. And again, the toolkit of resources and an educational video. So I'm going to take you just to our website so you can see where the plan is located. This is idph.iowa.gov /oral health and delivery systems, the oral health center, and the fluoride page. And it is just right here. Community water fluoridation in Iowa, our plan. So you can read through that and let us know if you have any questions. So I'm going to briefly go through some definitions of what a community water system is. There are many types of water systems. So what we mainly look at are the adjusted systems. They are the systems that add fluoride to the hopefully optimal amount of 0.7. Sometimes systems aren't adding enough each day to make it hit that 0.7 number, which is fine, but we don't want to see that on a continuous basis. So that's what the monitoring portion comes into play. We also have natural systems. If a system is considered natural, they're going to have a fluoride level above 0.6 milligrams per liter and no additional fluoride is added. If they are non-adjusted, their natural fluoride level is below 0.59 and they choose not to add any additional fluoride. If a system is considered consecutive, that means they purchase water from another system. It may or may not have enough natural fluoride or adjusted levels of fluoride. It depends who they purchase the water from, but they also do not add any additional fluoride. If a system is considered multi-source, then they receive water from multiple sources, wells, surface water, and no additional fluoride is added. If a system is deemed defluoridated, that means they have a very high natural fluoride level above that 4.0 milligrams per liter, again set by the EPA, and they must remove fluoride through reverse osmosis. We do have one system in Iowa, that's Mason Water Supply in Calhoun, Iowa. But they also choose to add fluoride to prevent tooth decay, so they do add fluoride once they remove it. So here is a table of our 2017 data. So when I talk about community water systems and I talk about the data, I have no access to wells. So this is all systems that serve 25 people or more and that are part of a community. So there's 1,091 systems throughout Iowa serving 2.8 million people. And I broke it out through fluoridated systems and non-fluoridated systems. So we'll go through this. So we have 151 adjusted systems, and these are the reports that I need to get every month to monitor whether they are adding the appropriate amount of fluoride. So these 151 systems serve 1.6 million people. But when you total up all of the people that are served by a fluoridated system, it comes to over 2.5 million people. So that really is 90.2% of Iowans have access to fluoridated water, which is amazing and wonderful. But what we also really need to focus on is if they have access to optimal fluoridated water, and that's that 0.7 number. And looking through the data, we've come to realize that only 63.6% of that 90.2% have access to optimal fluoridated water. So it's definitely something that we are working on here to increase that number. Our non-fluoridated systems, you can see there's 522 systems that serve about 270,000 people. 70 of the systems serve over 1,000 people that aren't fluoridated. So it's one of the next projects that we are working on to decrease that number from 70 so that more people have access to fluoridated water. And of course, optimally fluoridated water is what we want to focus on. So this map shows that 90.2% in a visual format. It's the percent of the population on a community water system receiving fluoridated water. We can't say optimal here because sometimes we don't get all of the data from the systems, and sometimes not all of the systems are hitting that optimal mark, even if they are adjusting. There are 3 counties that I want to identify. So Fremont, Monona, and Pocahontas. They all have 0% of their population receiving fluoridated water from a system. However, that doesn't mean that they aren't receiving any fluoride in their water because, like Pat was saying, fluoride is found in any water source. So taking a look at this next map shows that those counties have fluoride, 0.35 milligrams per liter. So the residents are getting fluoride. They are just not getting the optimal amount that we want to see. So this website is a very handy, and what I recommend people going to find out their level of fluoride in their community. We work with the CDC, so on the back end, I enter all the data, and this website through the CDC allows you as a member of the community to find out what your fluoride level is. All the green states do fluoridate and do track the fluoride levels, so they partner with the CDC as well. And I'm going to take us there just so that you can see. So we are in Iowa right now, and there's 99 counties listed. I'm just going to choose Adair County since it's the first one. And we find that there are 7 water systems in Adair that fluoridate, or that don't fluoridate. We know that there's 7 community water systems. So you can see that 6 of them do fluoridate and 1 does not. So if I go to Greenfield, you can see that they do fluoridate, and we are tracking them at 0.7 milligrams per liter. They serve around 2,000 people, and they adjust their fluoride level to the recommended level to prevent tooth decay. If we go back and look at the one that does not fluoridate, Adair Municipal Water Supply, you can see that their natural fluoride level is 0.45 milligrams per liter, and they serve 781 people. Now, all of this data can change, and it does change, and that's part of my responsibilities is to update this information and to work with communities that want to start fluoridating. But from the CDC, you can see that it does. If you do live in this community, you should be asking your dentist or your doctor about other ways to protect your teeth from decay. So it's a great resource. You can also pull reports and get a summary of the fluoridation status in Iowa, and it's just a great resource if you enjoy data like myself.
So let's talk about the goal of the Iowans for Oral Health Coalition. The Iowans for Oral Health is an initiative of the Iowa Public Health Association funded by Delta Dental of Iowa Foundation, and some of the activities of the coalition include maintaining community water fluoridation through education, partnerships, and advocacy. Members of the coalition reach out to partners when communities are reconsidering fluoridation of their public water systems. An example is that we have dental hygienists, we have pediatric dentists, we have pediatricians, we have public health administrators, and we all reach out to our partners when a community is threatened. We provide support to local boards of health when drafting position statements supporting community water fluoridation. And we'll take you to the webpage of the Iowa Public Health Association. And on there, you'll notice over to the left, it says Hot Public Health Topics. And then if you scroll down, you'll see Community Water Fluoridation. And if you go to that page, there are facts and links to support documents and also examples of position statements from local boards of health to help anyone who is looking for that type of support and information. We also refer communities to Delta Dental Iowa Foundation, where Maren Lenhart works with the cities and their water treatment operators on an application to be awarded funds to help maintain fluoridation in their community. Funding requests of up to $25,000 may go toward the purchase of new day tanks, carboys, testing and analyzing meters, and other equipment related to fluoridation needing replacement. We also look at supplies, and if a community is thinking of the supplies being expensive, this application can help with that funding. So how can you help? Help become an advocate through education, and when asked to refer residents in your communities, tell them to investigate credible sites and not just do a Google search for fluoride. There's a lot of misinformation and a lot of ideas and thoughts not based on scientific research. So where can you find information based on scientific sources? Here are four. The Campaign for Dental Health, www.ilikemyteeth.org of the American Academy of Pediatrics. Centers for Disease Control and Prevention has a lot of information on fluoridation. Sarah's already showed you the Iowa Department of Public Health page. And then there's the Iowans for Oral Health page that we just showed you. That's linked to the main page for the Iowa Public Health Association. So as we partner to maintain community water fluoridation, please feel free to contact either of us. Our contact information is right here. So if you'd like to reach out to us and need information to work in your community, we'd be more than happy to help acquire that for you. So Janine, we'll turn it back to you.
Thanks, Pat and Sarah. My apologies, need to unmute myself. Thanks for that presentation. A lot of good information there and a lot to absorb. Just want to remind all of our participants that we are recording the webinar today and that the PowerPoint is uploaded into the handout section of your GoToWebinar control panel. So if you slide over there and click on handouts, you can download the slides, and we will also have the recording and the slides posted to that very same web page on the IPHA website that Pat was just showing us. So let's go ahead and move into question and answer session. And to remind everybody, please use that feature on your GoToWebinar control panel where it says questions. You can type in questions there if you have any. We don't have any questions coming in just yet, so I'll just ask Sarah, as you were listening to Pat, and Pat, as you were listening to Sarah, anything additional that you would want to add for our attendees today?
Well, one thing that I would like to add for the attendees is that a lot of the dentists and physicians that we contact when a community is threatened actually think that communities are required to add fluoride to the water, which really isn't the case. So there is that misinformation out there. And maybe the reason that a lot of water departments don't hear from their local residents because that assumption is being made.
For sure. I know I've even had that conversation with the occasional policymaker and my own children's dentist, thinking, well, that's required, right? So that's a really excellent point, Pat. Sarah, anything you would want to add?
Yeah, just focusing on the data portion, just making sure that you all realize that the data is really kind of a snapshot in time. What's on the My Waters Fluoride website, when you can go and look at your fluoride levels, it is going to be a month behind because I get those, or maybe a couple weeks behind, but I get the data between the 1st and the 15th of the month and then go ahead and enter that into the system. So you can really see what your fluoride level is for February of 2018. And, the fluoride levels, they do change on a daily basis. That's why they are required to monitor. That's why water operators have to take a reading every day to make sure that they aren't adding too much fluoride. And, we're really kind of concerned about the low amounts of fluoride that may be added or of the natural level. We're not necessarily too concerned with a system going over 1 or 1.2. We are just mainly concerned if they are below that 0.6 level. And, you know, if a system is between 0.6 and 0.7, we don't advocate for them to spend the money and the time to increase that to the 0.7 mark. We just, you know, make sure that they aren't going below 0.6.
Right. Good point. I am not seeing any questions coming in here, so I'm just going to do a last call for questions. And if anybody's having challenges with the questions feature, if you just want to raise your hand, I'll be happy to unmute your line. But if we don't have any questions coming in, that's okay. You must have done a good job covering everything, ladies.
Great.
One more minute here. Okay. All right then. So we'll just conclude by thanking everybody for their time and for being a part of our session today. Pat Hildebrand, thank you so much for your time and all you do for IPHA and community water fluoridation all the time. And Sarah as well, welcome to your new role at IDPH and for being a great partner to us. And then I would just tell folks that we would like to thank you again for your time to share your lunch hour with us. And if you're an IPHA member, we thank you for your investment in our collective work and mission. If you are not yet an IPHA member, we invite you to consider membership. We need you to join us to build a shared value for public health in Iowa and in our nation. As you log off today, you will receive a brief, I promise, it's just 2 questions, but a very brief evaluation. And we'd really appreciate it if you'd provide some feedback on today's session and always reach out on input on future IPHA webinar offerings as well. Thank you all and have a good afternoon.